As Adele lay at the back of Sam's car, she looked out of the window. It was dark. It was already dark. She sighed. But at the same time, Timmy, her Gen Z son, he put on the radio. Can you imagine? He put on the radio. Did he want to listen to music she wanted? She was going to hospital, and he was putting on the radio. Sam was the one driving. As he put on the radio, the song of Bob Marley and the Wailers came on. Rastaman vibration, yeah, positive. There was nothing positive about this journey, she thought. Timmy, my chain smoker son. So you're not even sad that Adele is going to hospital. You're putting on music, listening to Bob Marley. Then she just thought, Bob Marley, is he not that famous Rastaman singer that died of one wound on his foot? Was it on his toe or so? They call the disease, is it malignant melanoma? She remembered. He had one wound on his foot, and they said they were going to, and the doctor said they were going to amputate the toe or so. But Bob Marley refused until the disease spread. I think I remember they said that it was a cancer. It was cancer. That disease, malignant melanoma, it was a cancer of the foot or of the toe. And it traveled up to his brain, to his lungs, to his stomach. She just thought, even me, I have wound. Partly on my toes, partly on my foot. I hope I don't have cancer. I hope I don't have cancer. She started crying. She was just looking out through the window, looking at the stars as she was lying down at the back of the car. Sam turned. Mama, please don't worry. Please don't worry. We'll soon be at the hospital. He now glanced angrily at Timmy. My friend, will you switch off that radio? You're not even serious. Anyway, as they drove, he was driving fast. She said, Sam, please drive carefully. It's night time. It's night time. As they entered into the general hospital, they saw what people were walking. A lot of people walking towards the casualty, the emergency. And as they parked, the security guard quickly ran to the car. Sam and Timmy wound down the window shields, the windows. He now peeped. The security guard peeped. He now saw Adele at the back of the car. He now said to Timmy and Sam, what's wrong with Mama? Mama is sick. Mama is sick. We have to bring her to the hospital now. He quickly ran. The security man ran into the casualty, ran into the emergency. A few seconds later, he came out with a young doctor. He was looking young from the way he looked. A young doctor with his stethoscope around his neck, in scrubs, and then the nurse too, in her uniform. They ran out. They came to the car. They also peeped in. The nurse and the doctor both spoke to Timmy and Sam. What's wrong with Mama? Can Mama talk? Mama, can you talk? Adele looked at them. Yes, I can talk. Do you know where you are? Yes, I know where I am. What's wrong with you? I'm feeling weak. Sam and Timmy looked at the doctor and the nurse. She's been sick for some days. They've been managing her wound on her foot at the chemist. But when I came to the house today, Sam said, I felt I needed to bring her to the hospital. Please. So quickly, the doctor motioned to the nurse. Quickly go and get the hospital attendants. Let them come and wheel Mama inside with a stretcher. Quickly. So within a few seconds, the nurse ran out with the hospital attendants, and they put Mama on the stretcher carefully, and they wheeled her quickly into the emergency room, into the casualty. As soon as they entered into the casualty, Mama looked around and she smelled something. That dreaded smell. She didn't like that smell. Adele hated the smell of the hospital. And do you know what the smell of that hospital was that she hated? She hated the smell of antiseptic lotion, antiseptic fluid. Hey, is it that Izal Abi Dettol? I hate that smell. I hate that smell. And then she looked again to her left, to her right. She was weak, but she was still very alert. She looked to her right and she saw a corridor just slightly at the back of the casualty. Also on the left, slightly at the back of the casualty. It was like a long corridor. And there were people lying on beds, on their beds, in that corridor. She noticed that most of those people that were lying on those beds were elderly people, elderly men and women. And guess what? Most of them had dressing, had bandage around their legs. and the dressings were stained. They were stained and they were smelly. Just like my own Lego. Just like my own Lego. Oh, I hope Adele thought they're not going to carry me to that same corridor that these people are lying down in. I hope they're not going to do that just because my leg is smelly. So they're putting these people in these corridors because their legs are smelly. She now, recounted her fears to Sam and Timmy as the nurses and the doctors were trying to get them prepared. She said, I hope they're not going to put me in those corridors. Please, I hope not. The doctors quickly came and rushed her into a nearby room. The doctor and the nurse were by her side. Timmy and Sam were by her side. The doctor began asking Adele, Timmy, and Sam some questions. Mama, how are you feeling? I'm feeling weak. I'm feeling tired. I've been sick for all these days. Doctor, please do something. My leg is smelling. I hope you're not going to put me in that corridor with those people. I hope you're not going to put me in that corridor with those people. The doctor laughed and he smiled. He started asking some questions. The history of what happened to her. When did she start feeling weak? When did she sustain her wound? How did she sustain her wound? What has been done to the wound? So she, Timmy, and Sam started talking, telling him what had happened. Adele was chipping in a bit. Most of the people that were talking were Timmy and Sam, giving the details. And then Mama was chipping in, giving them a few of the details. As the doctor finished listening, quickly, within a few seconds, he started to examine Adele. He examined her eyes. He told her to open her tongue, to open her mouth, to see her tongue. He checked her hands. He looked into her mouth. He checked her chest with a stethoscope. He examined her abdomen, what we usually call the tummy. He examined her skin. And all the while he was examining her, he was just nodding his head. Mama was thinking, this doctor, it seems that he knows what he's doing. And it seems he's getting an idea of what is wrong with me. I hope I'm going to get better. I hope I'm going to get better. So as the doctor continued to examine Adele, he now went down to the leg area. He quickly opened the wound. Of course, mind you, he was wearing his gloves. He opened the dressings and he looked to look at the wound. When he looked at the wound, he now looked at them. He said, as you can see, this wound is very, very bad. Can you see that it's looking black in some areas, especially around the toe? Can you see? All of them now turned to look at the wound. They said, yes, doctor. So please, I just want you to take note of this, okay? I'm suspecting that Mama might have diabetes, from what you have told me. And do you know the reason why I'm suspecting Mama has diabetes? All of them kept quiet. He said, well, first of all, remember, I asked you whether there's a family history of diabetes. And what did your son, your elder son, Sam, say? They both turned to look at Sam. Apparently, during this conversation, when the doctor had asked whether there was any family history of diabetes, Sam kept quiet. He paused a bit. As he was pausing, the doctor, Adele, and Timmy turned to look at Sam. He now, under low tones, he said, Doctor, actually, my friend diagnosed me with diabetes mellitus, type 2 diabetes mellitus, about 4 weeks ago. Adele and Timmy turned to look at Sam. Since when? He said, about 3 weeks ago. Remember David, Dr. David, my friend. They were taken aback. Dr. David. So Dr. David came from the States. Yes. When he came in, actually, he happened to have gone to buy this machine, this glucometer that I just saw there by the nurse's station. And he happened to come to my house with it. So just by chance, he said, let him just check my blood sugar. Because, we're gisting, I was telling him about how, how grandpa died sort of mysteriously. Remember that? I remember, Mommy, you telling me that your father, grandpa, had died just mysteriously. He developed wound. Then within a few days, he fell sick. And then within a few more days also, he developed a wound. And then they had to even cut off his leg. But he still died. And as we were gisting with Dr. David now looked at me and he was like, maybe you have a family history of diabetes mellitus. And since he had this machine with this glucometer that I'm seeing there by the nurse's station, I think we should check your sugar. And he checked my sugar. He actually pricked my finger and he checked my sugar. And my sugar was actually very high. It was actually very high. That was what Sam told the doctor while the doctor was taking the history. Timmy and Adele looked at Sam. They both didn't know these details. So Sam had been keeping this information from them for quite a while. And he didn't even say anything. All he was saying was that, Mama, you need to go for checkup. Me and my wife have gone for checkup. You need to go for checkup. So he had this information. So Sam and Timmy and Adele looked at Sam while the doctor was still taking this history. He said, so did you go back? Did you follow the advice that Dr. David told you to do? Sure, you told us that after he checked your blood sugar, that he told you to go and see one of his friends at the specialist hospital, who's an endocrinologist. Did you go back and see him to do further tests so he can continue managing this diabetes mellitus that you have? Sam just looked away. He just looked at the doctor very, very sheepishly. I'm supposed to have gone back, but I've not gone back, actually. I've not gone back. Oh, the aim has been defeated, isn't it? The aim of checking his blood sugar has been defeated because it has been 3 weeks and Sam has not gone back to see anybody about this diagnosis that his friend, Dr. David, made. So the doctor, Dr. Mohammed was his name, just sighed and he just calmed everybody down. He said, no problem, okay? We're going to check Mama's sugar right now. We're going to check it. If it's high, we'll need to do some other tests. I've examined Mama now and I've seen some signs that yes, she might have type 2 diabetes mellitus. And yes, from the family history, it sounds like you have a family history of type 2 diabetes mellitus. But of course, things will be confirmed when we do further tests. And of course, we need to call all the necessary specialists to carry out their own investigation. So please, you need to prepare, okay? You need to prepare. We have quite a few tests we're going to run. And so quickly he motioned to the nurse to bring the glucometer, which is the machine that is used to check for blood sugar. And quickly they assembled the machine, pricked Mama's thumb, and they checked. They quickly checked. And guess what? Guess what the value of Mama's random blood sugar, should we say now? Not fasting blood sugar, because Mama was not fasting when they took this blood sugar. In fact, she had eaten just about 2 hours before they came to the hospital. Okay? She hadn't been fasting for some hours, as is required when you're going to do the test of fasting blood sugar. Mama's random blood sugar was 200 milligram percent, 200 milligrams per deciliter. Whoa, it was high. It was high. So the doctor quickly said, okay, fine. We need to do quite a few things now. I'm going to write out some investigations for Mama to do. We're going to set up fluid now for Mama. So please, nurse, please bring that normal saline, okay? We need to set up normal saline for Mama. We need to pass in tubes. We need to pass in tubes. Adele, we need to pass in some tubes, okay? We need to pass in a line, an IV line for you, an intravenous line for you, for this, your drip that you're going to receive. We're also going to give you some medication through this, your vein, all right? And we're going to also pass another tube through where you pass urine. Hey, Adele screamed. You're going to pass what? A tube around the area where I pass urine? Please, I do not want any tube there. Please, it is painful. I know some of my colleagues that have gone through that, and I don't want that tube in that area where I pass urine. Please. The doctor said, sorry, Adele, but we need to pass it. Okay, we need to pass it. It's for your own good. And we're going to do these investigations. We're going to do full blood count to check the level of your blood because you're looking pale. Okay, you're looking pale. We're going to give you this fluid to rehydrate you because your tongue is looking so dry. Looking so dry. Then we're also going to do other things. We're going to do an x-ray of this, your leg, of your ankle, of your foot. We're going to check and make sure that the bones are not involved. You know what else we're going to do? We're going to do some other tests, some more and more blood tests. Urea, electrolyte, and creatinine tests to check your urea, electrolyte, and creatinine levels. We're going to do a wound swab MCS. We're going to take a sample of the fluid coming out of this, your wound, to check for the germs that are inside that, your wound. You know what else we're going to do for you? We're also going to check your lipid profile. We're going to check your lipid profile. We're going to do liver function tests. Yes, liver function tests. Mama, get ready. Sam, get ready. Timmy, get ready, please. It's going to be very, very capital intensive. So you need to be ready with funds. We need funds for all these tests. And remember too that we're going to call specialists. We're going to call the plastic surgeon to check Mama's foot, to advise us on how to go about managing Mama's foot. If for any reason the plastic surgeon believes that Mama's foot is at risk for possible amputation means we might have to remove part of that toe or part of Mama's foot because, as you can see, it's looking a bit black. Oh, Sam, Timmy, and Adele screamed. You mean Mama's foot is going to go? Her toes are going to go? Doctor, please, we don't want it. Please, help us. Doctor, calm them down. Don't worry. All right? Please be calm. Everything that we're going to do for Mama is for her own good. It's for your own good, Adele, and also for Sam, Timmy, and for her whole family's good. All right? That's why we're going to call specialists to manage Mama, to manage Adele. So please be patient. Be patient. At the same time, we're going to start giving Mama some anti-diabetic agents. We're going to start giving it to her, okay? Through the vein, okay? To help with control of the blood sugar. We're going to be monitoring Mama's blood sugar. And you also need to buy this same glucometer, because actually this glucometer that we're using to check for Mama's blood sugar is used for all patients. So it's better that Mama has her own personal glucometer that we can be checking every morning and every evening, so that we can be altering the dose of the drug we're going to be giving her, okay? And another thing, we're going to call the dietitians. Hey, Adele said, dietitians? So they're going to be giving me that kind of food that they give people that, have diabetes. So now I'll be able to eat my favorite yam, my amala, my pounded yam. Doctor, is that what you want to tell me? Is that what those dietitians want to come and tell me? I want my yam, I want my amala, I want my begiri. Hey. Dr. Mohammed smiled. You can have your begiri, but I'm sorry, mommy. I'm sorry, Adele, but you can't be having your pounded yam like you used to. Your yam, your fried yam, your rice. It has to stop. It has to stop. We have to change your whole diet now because you have been diagnosed with type 2 diabetes mellitus. The specialists will all come and see you. The endocrinologist will come, as I told you before. And as they're investigating you, we may need to also call more specialists for this, your leg, and for your general condition. So please, Adele, bear with us. All this is for your own good, okay? Adele sighed. Sam and Timmy sighed. Adele looked at Sam. Sam. So you were aware of all this. You were suspecting that Daddy, Grandpa had a diabetes when your friend saw you, and you didn't tell me anything. All you could tell me was that I shouldn't go to Paddy the chemist. You didn't tell me the reason why you're telling me all these things. All you were telling me was that, it's good. Let us go for annual checkup. Meanwhile, you have not gone to see your endocrinologist for your own condition. Is that how it's done? Sam kept quiet and he looked down. He really, really felt very, very guilty for what he had done. And he knew that he had done wrong. I'm so sorry, Mama. I'm so sorry. She sighed. Anyway, all is well with us by God's grace. And so Timmy left Sam and Adele and he went to the nurse's station. You know Timmy, Gen Z, he likes gisting. He went to check out the younger nurses that were there by the reception area. He started gisting with the nurse. The other nurses were busy setting up the IV fluid. They had already gotten a line for Mama. They had passed in the tube around the area where she passes urine. Yes, it had been very, very difficult because Mama was not compliant, but Sam was by her side and he was trying to convince her to be calm. And so that was done. Medication was commenced and the necessary consults were sent to the doctors that were going to come, the specialists that were going to come and review Adele. And investigation samples were taken. Mama had been diagnosed with type 2 diabetes mellitus, and she was on her way to being managed appropriately. But Timmy, as he was gisting with the nurse was telling him, was busy whispering to him. But do you know something? Adele's ears are very, very sharp. She could actually hear what Timmy and the nurse were discussing. The nurse was telling Timmy, now wow, so your mommy has been diagnosed with type 2 diabetes. Hey, I'm so sorry for her. And this her leg. You know what they call it diabetic foot. They call it diabetic foot ulcer. And many of them, can't you see them in the corridors there? Can't you see them on the right side and on the left side at the back there? Usually that is where we keep our diabetic foot ulcers when they come, because usually they're very, very smelly. They're very, very smelly. So if we put them in the main wards with the other patients, they can infect their wounds. So usually when they come like this and they're not too ill, like Mama, you can see that Mama, we rushed her into the resuscitation room to resuscitate her, so that the doctor could quickly assess her, resuscitate her. But many of them, they come from villages or nearby villages where all sorts of things have been done to them. And usually when they come like this, you can smell, even though you can smell the antiseptic in this casualty, I'm sure you can smell the rotten wounds. So that is why we keep them in these corridors, at least, pending when, the wounds are a bit cleaner, then we can move them into the main ones. Mama's wound too, I smelled it too, is quite bad, but maybe they're not as bad as these other wounds. But you have to pray. You have to pray that Mama's wound, is not so bad that she'll need the orthopedic surgeons come and review how. Because do you know what it means? It will mean that maybe they'll have to chop off Mama's foot, or maybe her toe. If she's lucky, maybe her toes. If she's somehow lucky, still maybe part of her foot. But if she's not lucky, maybe the whole of her foot too. I just pray that it will not reach her leg. Hey! Timmy said, please, I'm warning you. Stop talking like this. Stop talking like this. They not look at him. Maybe you come gist with me. I just to tell you the truth now. I beg. I have work to do. Leave me alone. And so, Timmy, Sam, and Mama began the journey towards treating Mama with type 2 diabetes mellitus, awaiting the investigation results, seeing how she responds to her treatment currently while she's in the emergency room, and also awaiting specialist review. See you again for another episode on Adele's journey. Adele with type 2 diabetes mellitus and diabetic foot. I'm Dr. Hadiza Marilia Suleiman, your favorite holistic reconstructive surgeon.